This is the Neurosurgery Podcast.
Good afternoon. I'm Connolly, a past president of the AANS, and I'm here this afternoon to have a conversation with Nino Chiocca, the new president of the AANS. We're here to discuss Nino's 2026-2027 year at the AANS, and I thought I'd start by asking Nino why navigating the impossible as a theme.
Well, thank you, Sander. And first of all, it's been such a great pleasure following in your footsteps. You've done an amazing job, working with the WNS, transforming it, and really setting us up for a great future. So thank you. You made my job very easy. Uh, so, uh, every year we come up with a theme, and I've been thinking about the incredible things we do as neurosurgeons. We deal with diseases that are thought to be impossible, and most patients and their family become very concerned and worried whenever they have a neurosurgical disease, even something as simple as a lumbar disc that causes incredible pain and suffering. Uh, and most of the other specialties think that what we do is almost impossible. It's almost science fictional. And so I thought that we navigate the impossible every day as neurosurgeons. We're confronted with desperate situations and we solve them. We solve them with our skills, with our training, with our education, with our compassion, even for diseases that don't have much of a cure, let's say malignant brain tumors or ruptured aneurysms. We can help navigate the patient and their family through those harrowing experiences. And so navigating the impossible really is the things we do every day as neurosurgeons.
Yeah. Of the impossible things, what is really top of mind for you in your kind of perch as a chair of MGB and the Harvard Medical School? What do you see as kind of top of mind impossibilities that we might be able to impact maybe in the next 5 years?
Yeah, I think that there's so many, and you can go each one of the specialties that we deal with. Think about cerebrovascular and more importantly, like the endovascular procedures, what has happened with that in the last 20 years. It's just tremendous, incredible, where now there are most of our vascular work is in endovascular. And so now, what's coming down the pike is all the robotics um, in endovascular and trying to do use robotics to navigate catheters to do some of the great work that they do. Um, some of the functional endovascular, where you put the electrodes in the blood vessels to control the functionality of the brain and or spinal cord, are tremendous possibilities. Uh, and we still, are working with neuroregeneration, stem cells, trying to regenerate the nervous system. There's some great technologies and sciences beyond that. And you can go through each area like this. I mean, if you think about the fact that we're now at the cusp of restoring functions that I thought would never be restored, having the blind see again, having the deaf hear again, having the people that cannot move limbs start moving limbs again. Those are things that even 5-6 years ago you would have thought were science fictional. But now with the knowledge of connectomics, the white matter trucks in the brain, what different group of neurons do, and knowing how to stimulate them with microelectrodes and microelectrode techniques and robotics in the entire brain computer interface. I think those are tremendous successes that we'll see in the next 5 years getting realized. And then there are, again, knowing about the molecular mechanisms of the brain allow us to now start thinking about applying drugs or genes for diseases that were not neurosurgical, Huntington's disease, ALS, diseases that we never thought would be neurosurgical may become neurosurgical in the future, where clinical trials are being done now, and even at an advanced stage. In brain tumors, where we still haven't cured the most malignant brain tumors, but our microsurgical techniques, our neuronavigation technologies, our visualization technologies, our ability to use more and more intraoperative neurophysiological monitoring is making us take out tumors that would have caused tremendous, devastating deficits in the past if you took them out, but now you take them out and patients are doing pretty well. Think about all the insular gliomas that now people take out, but also deep tumors in areas of the brain that I thought would be inaccessible. Um, and so you can think of that through various stages, through various technologies. Like spine is another one, right, where you becoming very minimally invasive, um, and and ultimately, I think the area where you're going to be able to cause or to lead to regrowth of discs through stem cells or gene therapies, or regrowth of bones through stem cell and gene therapies, um, is also becoming closer. So there are a lot of innovations that we thought were impossible that are becoming possible. And I think it's a great time to see those happen now.
Yeah. No question, and I'm excited just listening to you go down the list. We're obviously faced with challenges as well in neurosurgery, and as exciting as this future is, both near and far, what do you see are kind of the near and kind of maybe not so near major challenges that are going to be faced by both neurosurgery and neurosurgeons specifically in the years and to come, I guess.
Yeah, no, I think that, some of the challenges are known. I think that because we are small specialty, people say you're small but mighty, but we're still small. And so sometimes making sure we can advocate for ourselves as we become more and more um, part of large academic or corporations in the medical corporation system, uh, sometimes it's becoming more difficult. In the past, when we were sole proprietor of private practices, or we basically were able to um, do this on our own, um, it may have been easier. But now that most of us are becoming hospital employees or parts of academic medical centers, uh, trying to make our voice heard and advocate for ourselves and keeping our identity and autonomy is a bit in jeopardy. Um, I think our educational programs are great, but still, there's a lot of push on the next generation of neurosurgeons to really become just technicians and not be innovators, not be creators, not be thinkers. In our residency programs, there's more and more of a push through various ACGME and reimbursements and cost of, having residents spend as little time as possible doing innovative things and creative things, which is what propels our specialty, and just be there as technical operators, which they have to do, but they also have to know when to operate, what to operate for, and where the future is. Um, Governmental payers, other societies, how they um, are chipping away our ability to fund our programs, fund our neurosurgeons, compensate them correctly, is also an issue that it's a challenge that continues to confront us. But in spite of this, I do think that we're very unique. I hate to use this term, but I do think we're exceptional. We are exceptional in the sense that nobody else does what we do. Yeah, there are areas of maybe ENT or orthopedics where they come right to the intersection of what we do, but no other specialty does what we do And that is not true for other specialties. You have plastic surgeons and orthopedic surgeons. Sometimes they do the same thing. And so because we're so unique and exceptional, I do think that, and as the population ages, our services are going to continue to be required. And we're not going to be AI and robots are not going to supplement us or I mean, they will complement us, but they will not take over our jobs. And so I think we need to just make sure that we keep doing what we've been doing so successfully, which is take good care of patients, continue pushing for innovation, continue to push for the funding to get the innovation going, and continue to educate our residents the way we were educated, which is be technically excellent, remain a scientist at heart, and be a good person.
So you've touched on the innovation, the research, and kind of the human qualities that are so critical to being a neurosurgeon. When you're speaking with residents or junior faculty or colleagues that are in private practice, and they say, "I'm having such a difficult time uh, finding the time to be innovative and to do the research, even if I had the funding." What are some of the tricks that you've picked up from maybe your mentors or along the way that are kind of the hacks of the trade that kind of uh, have allowed you to be so successful doing this that maybe we could pass on in this conversation to others?
I don't think there's one trick and there isn't one way to do it. Everybody does it differently. And maybe for some people they don't want to do it. I'm not saying that everybody should be like that. I think everybody should appreciate it, but they don't necessarily need to do it. Uh, I think time management and being very, very attentive about your schedule and your time. I mean, there's times when you can't just do it. If you're on call, that's you've got to take care of patients. But when you're not, just making sure that you're have really good time management skills. Also, as neurosurgeons, we tend to be very individualistic, but you have to learn also to delegate and to be able to surround yourself with colleagues, collaborators, junior people um, that think like you do, and where the two of you can benefit, or that your team can benefit from each other. Um, and ultimately, I think just trying to keep up with what is happening in the world. It's not just about being there and putting the extra pedicle screw, but trying to keep up with the innovation and the technology. I think as neurosurgeons, we tend to be like that. We are self-selected to be like that. If you think about our residents, when when they apply, or medical students when they apply, we get the best of the best, and they tend to be people like that. They're very good at time management. They're pretty good team players, and they keep up with the innovation. So we don't have to really change the character and the genotype of people that we accept. We just need to somehow foster it, make sure that yes, you can do it. We have role models like you, Sander, like others. They can do it. You can do it too.
Right. So that kind of bleeds into the next thing, which is obviously you've led for a long time in neurosurgery. You've been a chair at multiple places. You've led multiple organizations, and obviously it's a satisfying role for you as to be in a leadership role. What are the pieces of those leadership roles that you've had? Oh, and I know they're all different, that really are the most satisfying elements in terms of being a leader in neurosurgery?
You know, a lot of things are satisfying. Some of them are personal, but I can tell you that, at least for me, seeing my colleagues succeed in whatever they decide to do, seeing my residents go out and become, or even medical students go out and become amazing neurosurgeons or amazing physicians or amazing scientists, uh, and seeing them do that without really much mentorship from me or anybody else, because they have it. And so your job is really to make sure that you can remove the occasional obstacle, but just let them do their thing. Seeing that happen, actually gives me the most pleasure, the most satisfaction. And it's, you feel like you've accomplished something, and that you've created the next, like us, the next group of leaders that are going to keep our specialty alive, well, and accomplish great things. It's a little bit like having a family, and I don't want to talk about other neurosurgeons, my kids, but really having your children accomplish great things gives you a lot more joy than if you've accomplished them.
Right. And so as we kind of wrap this up, and with an eye towards San Diego in the spring, are there any kind of closing remarks you have about the meeting, things that we, um, should be looking forward to as we move into that time of the year?
Yeah. Yeah, no, we're gonna have a great meeting. We actually have, for the plenary sessions, we've already have the entire cadre of speakers selected, and there are, there's some amazing people. Uh, we will start popularizing those names pretty soon, and they all try to, in their own way, represent a navigation of the impossible, not necessarily in neurosurgery, but in their own field and what they've done. And we're going to continue to have abstracts. We're also going to continue to have some industry presentations like you started, because, we want to have industry present some of their innovative technologies, because those are the things that are going to make us better as surgeons. So, really looking forward to it. I think we have a great group at the WNS, and it's been a real pleasure so far in the first 2-3 months of my presidency, seeing them get excited about what we're doing.
Great. Well, I certainly miss spending as much time with you as I did last year, but I'm
You
sure
can come
that you'll
back.
but I'm sure you enjoy all the great people that are around you and the wonderful staff we have at the AANS that makes all of this possible. So I'm gonna give you back your summer afternoon. I know it's gonna be a long winter in Boston, so each of these days you got to count very carefully. So with that, thank you, Nino, for taking the time. Really appreciate it. Your leadership has been um, really stellar and something to both admire up close and from afar. So thank you again for all your efforts on the part of neurosurgery.
Thank you, Sander.
Thanks.